Welcome to the Northeast Kingdom Voice. I'm your host, Scott Wheeler. Without a doubt, we are living through some very interesting, very historic, and very uneasy times. Today's guest is Dr. Les Lockridge. He's here today to help explain the coronavirus. Welcome to the show, Dr. Lockridge.
Thanks for having me again, Scott.
It is safe to say we are living through some very interesting times right now, and interesting doesn't always mean good.
Yeah, I think this is unprecedented for most people of our age. It's a pandemic, and we have to take it seriously. Now, taking it seriously doesn't mean panic. We want people to do everything that they can, but panic is always wrong.
Right. You were saying of our time, but I've interviewed people way back. Some of the people I've interviewed actually have survived the Spanish influenza of 1918. Needless to say, they are no longer with us. But I don't even believe during the influenza there was as many shutdowns as there is occurring now. Like back then, churches shut down, public gatherings did, but I'm not sure if, I don't believe the border and such shut down.
Well, you have to remember that was a different time, and there were different expectations in terms of somebody's health and longevity.
Right.
I think that the response that the entire nation, probably the entire world has had, has been unprecedented.
Right. Yeah, it's been, I guess the word might be surreal, just to watch this all happen, and I think a lot of Americans don't know what to think.
Well, there's an awful lot of information out there, and some of it is conflicting. What's more, a lot of the events that are taking place now, the closures across entire states of all the bars and all of the restaurants, the cancellation of the NCAA tournament, none of us are familiar with this. None of us have seen this before. So that's certainly going to add to not just the confusion, but anxiety. There are serious considerations to be had. We want to be sure that people are operating on good information.
So there's still a considerable number of people out there who do not believe this is a real threat. What say you?
The threat is real. Let's start with the situation as it is. Right now, the impact has not been great in Vermont. As of last night at 8 o'clock, the Department of Health was reporting 17 total cases in Vermont. Now, that's not very much. We haven't had any deaths. So the actual impact in Vermont thus far has been much greater socially and much greater economically than it has been medically. Now, having said that, the potential for something very bad is certainly there. There are reasons to believe that we can incur an awful lot of negative impact from the actual health threat that the virus poses. Two issues feed into that primarily. Number one, contagiousness. Number two, virulence. As far as contagious, we probably haven't dealt with an outbreak like this in anybody's lifetime that's alive right now. Spanish flu, as you alluded to, that's a really good example, and the devastation that it caused when you have something that's really contagious and people are not prepared for it. What's the real issue with contagion for the COVID? Well, you can surmise that to some degree with a comparison with influenza. Now, like I said, the health impact thus far of the COVID-19 has not been great in Vermont. 17 cases. We've had thousands of influenza cases in Vermont already. But the uh, the contagiousness of the virus far outstrips influenza for a couple of reasons. One is the incubation period. The typical incubation period for influenza is only a couple of days before symptoms start. And in those couple of days, there is some virus shedding for influenza, but not very much. Certainly not to the degree that people shed virus and are therefore contagious when they do have symptoms of influenza. And then they usually stop shedding virus something in the range of 4 days to 6 days into the infection. Now, compare that with COVID-19. You've got a 7-day incubation period. That means you can be exposed and feel fine for 7 days and be out and about having your normal contacts with people and be shedding virus and highly contagious the whole time. Then the illness typically takes something in the range of 7 days to get over, 3 to 7 days, depending on the health state you were in when you originally contracted the virus. But 7 days in, people usually are feeling better. However, they're still shedding virus, and it looks like the virus persists in the lungs for at least 3 weeks on average, and maybe up to 6 weeks in some individuals, and you can go on to continually shed virus through that whole period of time and therefore make other people sick.
So how do you contract it? Is it through the air? Is it through touching infected?
Well, that's another issue with the contagion of the virus, and another thing that makes it such an important virus and potentially such a disaster. There's very little surface contact infections taking place with influenza. It does happen, but it's unusual. They generally have to be really big respiratory droplets and contacted by the uninfected individual fairly rapidly for them to contract the virus for influenza. Now, in contrast, COVID-19 can be shed, it seems, pretty regularly through surface contact, and the virus can actually live on household surfaces for 2 to 3 days after it's been planted there. So it can continue to be contagious just on a surface. You don't even have to have contact with the patient for a few days after a patient has been in an environment. As you can imagine, this leaves an awful lot of dark area for people. A lot of people are at risk when not only are they unaware of it, they wouldn't have a great reason to suspect it. You compare that to influenza, and you probably have to be within 6 feet of one of the patients to actually contract and get sick from the influenza virus.
Right. I'm assuming that you would agree that probably the best place to turn to for information is probably not your typical Facebook expert who is probably down in the basement somewhere, because there are a lot of Facebook experts out there who apparently their Facebook knowledge really surpasses advanced doctorate degrees.
Yeah, I think most of us seen the some of the rumors out there about prevention and treatment of COVID that range from snorting cocaine to drinking bleach. Please don't do those things. The government and the industry are hard at work right now trying to come up with an antibiotic and a vaccine. They have some of the best scientists, infectious disease experts, and epidemiologists in the world working on this. A rumor from Facebook is not going to be able to compare with that and could lead to real harm.
Right. The one thing I do here is, really, what's the big deal? It's only a flu, and we go through the flu season every year. That's the one thing I read constantly. And I think, I'm not sure if you will agree, but a lot of people, when they contract COVID-19, they're probably not going to really suffer that bad. So what is the big deal?
All those things you said are correct. most people are going to experience essentially a 3 to 7 day bug and really not even need medical care. They won't need to go to an emergency room. They certainly won't need admission to the hospital. Very, very few will end up in the ICU, relatively speaking, and even fewer than that will end up on ventilators. However, for a certain subset of the population, this is an extremely virulent disorder. It's a very bad disease. It's in the elderly, immunocompromised, and generally frail population, quoting a mortality rate anywhere from 1 to 5%. You want to compare that with influenza, that usually costs us about 50,000 American lives per year. The death rate, mortality associated with influenza is only something in the range of 4 to 9 per 100,000. So you've got something that is magnitudes more deadly than influenza. There are going to be lots of lives lost on this. They've lost more than 50 in Washington State already. There are reasons for concern for this, and there are reasons to take precaution.
Right. Yeah, because I know I see a lot in the news about the bell. They want to flatten.
Mm-hmm.
Explain that.
Well, flattening the curve doesn't necessarily mean keeping people from getting infected. What it means is a lower rate of infection and spreading the infection out over a longer period of time. The idea behind that is we don't overwhelm the nation's healthcare system. We don't overcrowd ICUs. We don't use up all of our ventilators. We don't, by virtue of influx contact, infect a lot of healthcare providers and therefore cripple our system. That's what they want to accomplish. It's not necessarily going to cut down on the total number of cases, although that probably will come along as part of that naturally. But what they really want to do is spread this out over a longer period of time so that we don't just completely overwhelm our system and get into the situation in Italy where they actually have to make some choices as to who's going to get life-saving treatment and who won't.
Now, so why close the schools? Why close sporting events? Is that because just not to compact people?
Essentially, those events are typically attended by people that, like we said, are going to have a 3 to 7 day bug.
Right.
But those people will then contract the virus, and like I said earlier, they're going to have 7 days before they know they're sick. And since they were in contact with a lot of people that they don't know and aren't going to see again, those people could get sick too. That'll be no sentinel for them. And they'll go around and infect other people. Some members of their family are going to be old and frail.
Right.
There are going to be immunocompromised people out there that get incidental contact. And trying to keep these things from happening, at least for a while, is aimed at protecting those individuals, not necessarily the people that would go to those events or that would go to school.
So this isn't only about you as in the individual. This is about even your loved ones. But like, for example, in my personally, on a personal level, I'm not too worried myself on a personal level. But on the other hand, I then have family members, including an older father who's 85. I work with people in advanced age. So just because I'm not worried about myself, I still need to worry about the people around me.
Yeah, that's absolutely right. This is about community responsibility.
Right.
And we need to do everything that we can.
Right.
Don't underestimate the potential for this. It could be very bad. Likewise, please don't panic.
Right.
There's a lot of crazy behavior out there these days, and I understand it.
Are you talking about like getting 100 rolls of toilet paper?
I'm talking about getting in a fist fight over 100 rolls of toilet paper.
Right.
Please don't do that. Let's take a step back for perspective on this. The government's not going to let people, for instance, starve to prevent them from getting a 3 to 7 day virus. That's not going to happen. America produces more food, more agricultural products than any other nation in the world. We've always been the best at it. We're going to always be the best. Distribution could potentially get spotty at times, but it's not going to dry up. And toilet paper has nothing to do with this. Please don't get in a fight over toilet paper. Winning's not going to get you anything, and losing's going to get you even less.
Right. So what can people do to attempt to avoid getting it?
Well, first of all, avoid people that might potentially have it. There's a lot of social isolation going on right now. While in general I'm an opponent of that, I think right now it's quite appropriate. I think that we communicate in a very sterile way these days, and for once that's good. Text your family members, email your family members, call your family members, FaceTime your family members instead of actually going to see them if they live outside of your home. Try not to gather in big groups, and be sure that everybody you have contact with is of the understanding that we're all going to be responsible for ourselves, that we're all going to be vigilant about our own health. And wash your hands. Wash your hands, sanitize your hands, don't touch your face. This is the best thing that you can do. If you start thinking about what you contact that other people have contacted on a just a day-to-day activity routine, it's actually quite a lot. I have indirect contact with 4 or 5 people every morning before I even get to work. And this is something that I hadn't thought about until this crisis came up. And try to not touch your face for 1 hour and see how hard that is. It takes a lot of personal discipline. It takes a lot of personal training, but you'll be glad. And if everybody does it, it could go quite a ways in minimizing this problem.
Right. And back a little bit of history, like I was asking my father about previous epidemics, and he said back when he was growing up, the health inspector, if you had like scarlet fever or measles, they'd come right to your house, put a maybe nail onto the side of your house or right on the door, a sign saying, quarantine, nobody in, nobody out. Now tell me, that goes on to this. If you're going to quarantine yourself, if you don't have it, if you're going to basically shelter in place, does that mean you can't go out in the field? Does that mean you can't go out for a walk? Or does that just mean to watch your surroundings and not be around people largely?
What we're trying to avoid is close interpersonal and trafficked area surface contact.
Okay.
If you go for a walk on the bike path, even if you are going to encounter other people and just say hi as you walk past, that's perfectly safe. I want people to continue to be active. I want people to get outside. It's that time of year in Vermont where it really will drive you crazy if you can't get out. And it's the end of the winter, and there are a lot of people that haven't really set meaningful foot outside in quite a while. I don't want that to end. So please don't think of this as leprosy.
Right.
Just be smart.
Right.
Be mindful.
Right. Now, what I see if I'm doing this right is I wash my hands ad nauseum, probably too much. I use hand sanitizer, and actually my hands are drying up, I think, or getting dishpan hands. But I also wash down everything, as in, disinfectant. I think I'm getting pretty good at this. But it's amazing. Like, I've actually been conscious about it. So I don't know if other people, you go to a public restroom and you wash your hands and then you reach and you open the dirt, and it's like, that kind of defeats the purpose. So, and then the other thing, they don't want you to shake hands. So I guess according to the last presidential debate, they elbow bumped. So I guess you have to really, it might seem far-fetched, but, I heard something once. You might not know what success looks like. As in success, if there isn't this huge outbreak, there's going to be people who are going to say, well, look, this was all hysteria. But we do know what failure looks like, as in if it's a mass epidemic. And I've got to mention, I did bring up this flu of 1918, but to be fair, those were different times too. There wasn't the technology, there wasn't the communication, so I don't think people really need to fear that. So I just wanted to put that out there because these are different times.
Yeah, very different times. Hopefully we're not going to get down to having notices nailed up on people's doors. I don't think that we need to be putting the Scarlet C on anybody. Responsibility is what I would stress with that. Also, I don't really think elbow bumping is going to save the world, but hand washing might.
Yeah.
This is something that we have proven works to contain the spread of viral upper respiratory infections. Let's keep at that because at least we know that works. Right. A lot of other things are mainly dogma.
So I have noticed there's been a great deal of information out there about how to attempt to avoid contracting it, but there's less out there about what do I do if I think I have it, and how do I survive it?
Yeah, and that's a nebulous area that's going to keep changing, keep evolving as we go through this. First of all, at this point, anybody that fits reasonable criteria for diagnosis probably ought to be tested just for containment purposes. After a while, we're going to be past containment stage, and that will either be because of failure of containment or because of success of containment. Right. At that point, testing is going to be a lot less important. But you need to contact your doctor. And every office has probably their own plan, their own protocol in place for dealing with this. We have a very strict protocol at our office that involves communication, screening, personal protective equipment, and routing patients in such a way that they will limit their surroundings exposure to absolutely minimal.
Right, and I think in the long run, once we get through this, I suspect we and you as a medical professional will probably have learned something from this that will prepare you for other issues that should arrive in the future.
Yeah, I would agree. For one thing, it's going to really put on display and stark relief any of the holes that we have in our disaster preparedness and, our healthcare system in general. And we've already seen some of that. It's being addressed, but it's harder to build a plane while you're flying it. Right. So I think when the dust settles on this, we're going to look back and say, all right, this needs to be shored up, that needs to be worked on, and we will come out with a stronger healthcare system in the end.
Right. So we only have about 5 more minutes left. What more would you like to tell the viewers and listeners?
Be mindful, okay? Be practical. You don't have to live in the John Travolta plastic bubble through this. And again, most of you are going to have a very mild experience with this. maybe 90% will experience this as little more than a 3 to 7 day bug. But be considerate of the people around you. Be considerate of who in your family or friends or inner circle or at work might be a little bit frailer, and take special precaution where it comes to them and any kind of contact with them. Wash your hands, don't touch your face, and be healthy.
Right. With I've changed my life a little bit, even though I initially said I probably wouldn't. Like I had a trip to New Mexico all planned in first part of April. But then as I said, I'm not worried about myself. But then I was thinking of my father. But then my pregnant daughter, and then I just said, well, the trip always can wait, and that's the decision my wife and I made. So the message is be wary, but don't panic, and there's no reason for that 100 rolls of toilet paper.
No, toilet paper is going to be there. That's going to be one of the last things that we have to worry about. And I applaud you for your philosophy towards that trip. I know that you guys were looking forward to it. I know it was important to you, but the fact is it can be put off.
Right.
And if we take a realistic look at a lot of our plans and a lot of our life activities, we're going to see the same thing. The fact is, I was really sad when JP closed for the year, and I'm going to miss out on a lot of good snowboarding, and so are a lot of my friends, but that can be put off. We don't have to have that. My MMA gym in Burlington closed for the foreseeable future, and this is something that I encourage them to do. We're all going to miss it, but this can be put off, and life will be the same in 2 months if we don't do any of it.
Right. In closing, I've got to say, though, through this, I've actually seen some very good things happening in our communities. I think it took a while for people to get it, to figure this out, and I still think people are trying to figure it out, but there's a lot of good people who are stepping forward to help people, particularly the most vulnerable people, and I think we'll continue, because I think we will I think this will show the best within us.
Yeah, I agree. Crisis brings out the best and worst in humans. Try to be the best.
Right. Okay, thank you for coming on, and we'll have you back on again if we need to update.
Sounds good, Scott. Thanks again.
Thank you. And thank you to the viewers for tuning in to another segment of the Northeast Kingdom Voice.